Good morning, everyone. It's currently 6:30. I woke up at 5:45 today, got fully ready and everything. I just sat down at my desk to eat breakfast and kind of like look over some stuff for today. Anyway, it's Friday. I am still on my orthopedic rotation and I'm like halfway done with it, so that's kind of exciting. I figured I would take you along with me today now that I kind of like know a little bit more about how things work. So basically the plan for today is I do have to go in early because I have an inpatient. So an inpatient is like when you saw a patient yesterday and they had to stay overnight. So I have one that stayed overnight and it's getting surgery today. And the surgery, it's a cat with broken foot. So cats have 5 metacarpals as long as they're anatomically normal. This one is sort of minus the fractures. So they normally have 5 metacarpals and this one broke 4 of those 5 metacarpals. So I'm going to try and show you kind of like a quick rundown, easy version of what metacarpals even are. This is obviously a human hand. It's not exactly how a cat's paw is gonna work, but I will like put up an image to kind of show you how a cat's bone anatomy looks like. So these would be your phalanges, and then these would be the equivalent of a cat's metacarpals. So to show you how we like kind of number things, this would be 1, 2, 3, 4, and 5. So this cat broke its metacarpal bones and it broke 2, 3, 4, and 5. So 2 and 3, these ones right here, they were just broken and then they stayed in place, which is like a pretty easy enough fracture to fix. However, 2 and 5, they fractured and then they were displaced. So they moved away from their site of break, which means you have to like go in, manipulate the bone, move it back to where its location should be. It's a little bit more of like a in-depth process. So I have to go in a little bit early to check on that cat and make sure that it's ready and healthy to be sedated for surgery today. I just spoke to anesthesia. They took my patient. I called the owner letting them know we're inducing, and now I'm getting ready to go to surgery. So I'm changing into my green scrubs now. I obviously cannot show the animal or the actual procedure, but here are some pictures of me during the surgery. So the first thing that we did was we made a skin incision right in the middle of the foot, like I've drawn here. And then we used these things that are called K-wires, which are these wire metal rods. And so you stick that in the medullary canal, which is like the middle part of the bone, and you cut it short. And then you take the distal part of the bone, aka the bone furthest at the bottom of the foot, and you take that fracture and realign it and place it on that K-wire so that the bones are aligned and held in place. And then you kind of just push them together to make it all tight and compact, to make sure it's aligned well. And then we closed up the sub-Q and the skin, and that was how we fixed those fractures. Done in surgery, everything went really well. There's people like right out there, so I don't want to talk too loud, but anyway, I'm done. So now I'm going to change back into my regular scrubs and get out of like the surgery scrubs. I'm back home now and everything, changed out of my scrubs. So I'm going to kind of describe like the process of what I did after I got out of surgery. So after I get out, I go get my patient set up in ICU. So that means I have to like get a cage ready. I have to round to the ICU techs, which means telling them like who the patient is, why they're there. So fractured metacarpals and then surgery to repair that. I'll talk about what medication they're on, their diet, if they have any special like needs. So if they had respiratory issues, heart murmurs, anything that could kind of be deemed a potential health concern. We'll go over their code for CPR. So if they're a no CPR / no code, or if they're closed or open chest. And then after that, we'll make sure they're completely set up and ready in the ICU in their cage, the patient, not the ICU tech. And then once I'm done with that, I will go start typing in notes. So I have to write a surgery report, a SOAP for every day that they stay there overnight. And then I have to do a discharge form. And most of that paperwork kind of takes a long time depending on what procedure they're there for. And then at the end of the day, we round. So we do topic rounds and we do patient rounds. So the patient rounds will discuss the cases that we're following. And we do that with our peers and the clinicians. And then the topic rounds, basically the clinician will just present on a topic, whether it be like fractures, osteoarthritis, juvenile orthopedic diseases. Those are just kind of some of the topic rounds that we discuss. So basically that clinician will just teach us over that topic round, essentially. And so that's basically what I did. After we get out of surgery, it's a whole lot of paperwork from that point on because you're having to type in so many notes over like just everything. That's basically what I did the whole rest of the day was just paperwork. And then I left around 5:30. I'm home now. So I made myself some dinner and now I'm basically just gonna get ready for bed. And I did look up some cases for what we have tomorrow. Went ahead and selected the cases that I want for tomorrow, and I will just kind of do a little bit of like not research, but a little bit of like looking at the history of that patient so that I know why they're presenting to us, a little bit about them and their history. And that way I'm not going into the room being like, oh, what are you here for? So a lot of paperwork goes with this stuff, and that's somewhat draining because it's kind of hard when you're only following like 1 to 2 patients a day, because that's kind of the patient load is like 1 to 2, and it gets draining when you're doing a lot of paperwork and not a lot of what feels like medicine. But overall, I feel like this has been super educational and beneficial for me. I've got to learn how to do proper orthopedic physical exams, learned about orthopedic diseases, fracture repairs, TPLOs. So I'm really enjoying it so far. But for the rest of the night, I'm just gonna basically work on my paperwork a little bit more and preparing myself for my patients for tomorrow.